The meal tray hit the wall at exactly 6:47 in the morning, and the sound it made wasn't a crash, it was a detonation. Scrambled eggs and steel splattered across the hallway in a single violent arc, and before the echo had even died, every nurse on Ward 7 was already running in the opposite direction. Every nurse except one. She was 29 years old, 5'4" in her sneakers, and she was walking toward the sound. Her name was Nora Calloway, and the man waiting at the end of that hallway hadn't spoken a coherent sentence in 11 days. He'd put 2 orderlies in the hospital's own ER, fractured a security supervisor's wrist, and reduced 3 experienced psychiatric nurses to written incident reports and extended leave. The ward's senior staff had tried sedation protocols, physical restraints, and 3 different attending psychiatrists. Nothing worked. Nothing even came close. What stopped him wasn't medication, wasn't a code team, wasn't the 6'2" security officer standing 20 feet behind Nora with his hand on a syringe. It was her voice. 2 words spoken quietly, like she'd said them 100 times before in places a lot worse than this. At ease. If you're just finding this story, stay right here until the very end, because what happens next will genuinely surprise you. Hit follow so you don't miss a single update. And if this story reaches you wherever you're watching from, drop your city in the comments. I want to see exactly how far this one travels. Harlow Veterans Medical Center sat on the western edge of Dunmore, Wyoming, where the high plains ran flat and unforgiving toward a ridge of mountains that never seemed to get any closer. It was a mid-sized facility. Not prestigious, not funded like the VA campuses in Denver or Salt Lake City, but functional in the way that underfunded institutions learn to be functional, through shortcuts, overworked staff, and a culture of making do. The psychiatric ward occupied the 4th floor, separated from the rest of the hospital by a reinforced stairwell door and a reputation that kept most of the nursing staff from ever volunteering to rotate up there. The patients were veterans, almost exclusively, men and women who had come back from places the news had long stopped covering, carrying damage that didn't show up on x-rays or blood panels. The ward had 16 beds and, on most days, 14 occupied ones. Nora had been assigned to the 4th floor 3 weeks ago, and nobody had been particularly subtle about why. Dr. Greer thinks it'll be a good fit, the charge nurse, a compact and precise woman named Beverly Pruitt, had told her during the handoff briefing. Beverly had a way of delivering information that felt like she was choosing every word for maximum plausible deniability. You're steady. Low effect. The patients up there respond better to nurses who don't startle easily. What Beverly didn't say, and what Nora had understood perfectly well, was the other half of that sentence. And if things go sideways, you're new enough that we can write the incident off as a training failure. It was the kind of assignment you gave someone you weren't sure you wanted to keep. A test, or a way to be rid of someone without the paperwork of a formal complaint. Nora had taken the badge, said thank you, and gone upstairs. She was from a small farming town outside of Laramie. Her mother had cleaned houses, her father had worked highway maintenance for the county until his knees gave out. She'd put herself through a 2-year nursing program at a community college, taken out loans for the BSN, and spent the 3 years after graduation doing the kind of work that nobody at Harlow Medical had asked about during her interview. Because she'd been careful not to mention it, and they'd been careless enough not to dig. She had served 2 deployments as a combat medic with the Army, one in a forward operating base in eastern Afghanistan, one in a medical support unit attached to a special operations task force in northern Syria. She'd treated blast injuries in a tent with no air conditioning at 110 degrees, performed emergency airway management on a 19-year-old with half his face gone, and once spent 14 hours as the only medical personnel between 12 soldiers and the nearest surgical team. She'd earned a commendation she kept in a shoebox under her bed and never talked about. She didn't talk about it because she'd learned, the first time she'd mentioned her service during a job interview, exactly what happened. The interviewer had smiled and said, "Oh, that's so impressive, but this is a different kind of nursing. It's more emotionally nuanced here, you understand." As if she'd spent 3 years in the Army learning to not feel things, rather than learning to function while feeling all of them at once. So she'd stopped mentioning it. She showed up, she did the work, and she waited for someone to actually pay attention. Nobody had. Not here, and not at the 2 other hospitals before this one. Patient Marcus Hale had been on the fourth floor for 17 days when Nora was assigned to the ward. His chart, which she read the night before her first shift with the kind of focus she'd once used to study medevac protocols, told her the basic outline. 51 years old, retired Army Special Forces, 2 combat tours in Afghanistan, 1 in Iraq, 1 undisclosed assignment whose details were redacted behind a classification notation she'd only seen a handful of times in her life. Admitted following a crisis incident at his apartment complex in which he'd barricaded himself in a stairwell for 6 hours with his service dog, a Belgian Malinois named Rex, refusing entry to paramedics and local police. The admitting diagnosis was a cluster that Nora had seen before: PTSD, major depressive disorder, alcohol use disorder in reported remission, behavioral dysregulation secondary to environmental stressors. The chart noted he had been a model patient for the first 8 days, and then something had shifted, and since then the ward had been operating in a state of controlled fear. The incident reports were written in the careful, passive language of people who were documenting without quite explaining. Patient became agitated following interaction with administrative staff. Patient refused meal tray and made threatening statements. Patient's dog was temporarily relocated per safety protocol. That last line. Nora read it twice. She found the animal care notation buried on the second-to-last page of the admission file, added as a footnote to a facilities memo. Rex had been moved from the patient room to a ground-floor kennel area 11 days ago, following a complaint from a staff member who'd been startled by the dog in the hallway. The decision had been authorized by the ward administrator, a man named Dennis Chow, and co-signed by the hospital's director of patient services, Dr. Margot Stovall. The timing matched exactly. Marcus Hale had been cooperative, stable, and almost communicative, right up until the day they'd taken his dog. Nora closed the chart and sat for a moment in the break room with a cup of coffee that had gone cold while she was reading. She'd seen this before. Not in a hospital, in a different context, a harder one, where the consequences of misreading someone's behavior had been immediate and irreversible. She'd learned, over the long way, the difference between a patient who was dangerous and a patient who had been made dangerous by the people responsible for his care. The first kind needed containment. The second kind needed someone to stop making it worse. Marcus Hale was the second kind. She poured the cold coffee down the sink and went to find Beverly Pruitt. "I want to talk to someone about the dog situation," Nora said, keeping her voice neutral and even, the way she'd learned to talk to people who held authority they were slightly insecure about. Beverly looked up from the medication cart. "What about it?" "The patient's behavior escalated immediately after the animal was relocated. 11 days ago. I think those things are connected." Beverly set down the medication card she'd been holding. "I'm going to stop you right there because I don't want you going in there and creating unrealistic expectations. Marcus Hale is not... He's not a project, Nora. He's a severely ill patient who has been resistant to every therapeutic approach this ward has tried. The dog situation was a safety decision made by administration." "Was it cleared with his care team?" A pause. "It went through the proper channels." "That's not what I asked." Beverly's expression did a small, controlled shift. Not quite irritation, not quite respect. Something balanced uncomfortably between them. "I'd encourage you to focus on your assigned patients," she said, "and to trust that the staff who've been on this ward considerably longer than 3 weeks have a handle on the situation." Nora nodded. "Of course." "Thanks, Beverly." She left the conversation exactly where it was and went to do what she'd actually planned to do from the beginning, which was to stand outside Marcus Hale's room and listen. He was awake. She could tell before she reached the door. The quality of the silence inside the room was the kind that had someone in it, not the flat silence of an empty space. She'd learned to hear the difference a long time ago, in places where the distinction had mattered considerably more. She didn't knock. She stood just outside the doorframe, visible in her peripheral line, but not blocking anything, and she said quietly, "Mr. Hale, my name is Nora Calloway. I'm the RN assigned to your care starting today. I'm going to stand here for a few minutes, if that's all right. You don't have to talk." Silence. She waited. She was good at waiting, another skill that people with comfortable jobs in well-lit hospitals didn't always understand the value of. After about 4 minutes, a voice came from inside the room. low, scrapped sounding, like something that hadn't been used in a while and wasn't sure it still worked. "You're not from psych." "I'm from nursing. Fourth floor general psych assignments." "No." A pause. "I mean, you're not. You move differently. You stood outside the door for 11 seconds before you said anything. You positioned yourself in the low-threat quadrant." Nora felt something register in her chest. Not surprise exactly, but the particular attentiveness that came with recognizing she was being accurately read. "You were counting." "Habit." She was quiet for a moment. Then, "May I come in?" Another pause, longer. "You armed?" "No." "I know you're not. I could hear it. I'm asking because I want you to understand that I noticed." "Understood." "Come in." The room was dim, curtains pulled against the morning sun. Marcus Hale sat in the chair by the window rather than the bed. That was the first thing she noted because it meant he wanted his back to a wall and a clear line to the door. He was a large man, broad through the shoulders, with the kind of controlled stillness in his body that read, to most people, as menace. To Nora, it read as discipline. A person who had spent years training his body to do exactly what he told it to, and who was now having to work very hard to maintain that discipline against circumstances that were actively working against him. He looked at her. Not the casual glance of a patient assessing a new face, the direct, measuring, zero social performance look of someone who had spent years reading people for survival purposes. She met it without flinching and without forcing anything. "You served," he said. It wasn't a question. "2 deployments. Combat role. Medic. Forward support." He was quiet for a moment. Whatever calculation he was running behind his eyes, he ran it to completion before he spoke again. "You treated Special Forces casualties?" "Some. 1 rotation attached to a task force in Syria." Something shifted in his posture, not relaxation exactly, but the specific adjustment of someone who had just recalibrated their assessment of a situation from one category to another. "Okay," he said. "Okay? Okay. I'll talk to you." She spent 40 minutes in that room. She didn't do anything that a hospital-trained psych nurse would recognize as therapeutic intervention. She didn't use reflective listening frameworks or trauma-informed dialogue prompts. She asked him questions that she actually wanted to know the answers to, and she answered his questions with the same directness. When he asked how long she'd been at Harlow, she told him. When he asked if she'd read his chart, she said yes. When he asked if she understood why he'd put the orderly through the hallway wall 8 days ago, she said, "You felt cornered. Physical response to a perceived threat. I'm guessing the restraint protocol triggered it." He looked at her for a long moment. "Yeah." And Rex being gone. A change moved through his face. Something that wasn't anger and wasn't grief but occupied the compressed space between them. "Yeah." "Tell me about Rex." He told her. Not everything, not the classified pieces. She didn't ask about those, but enough. Rex was a Belgian Malinois, 8 years old, trained by the same handler program that had paired them overseas. They had been through 3 deployments together before Marcus was medically separated. Rex had detected 2 IEDs, alerted on a hostile shooter on a rooftop that Marcus hadn't been able to see, and once, during an ambush in conditions that Marcus described in the flat, factual language of someone reporting rather than reliving, had positioned himself between Marcus and a door that had been booby-trapped, alerting just seconds before Marcus would have walked through it. "He's not a pet," Marcus said. "He's not a therapy prop. We have operational history together. That dog understands me in a way that—" He stopped. Reset. "When they took him, I didn't know where he was. 11 days and nobody would tell me if he was being fed, if he was okay, if he was losing his mind in a cage somewhere. And they acted like I was being dramatic about it. You weren't. I know I wasn't. How long since you've seen him?" 11 days. Nora looked at the door, then back at Marcus. "I'm going to try to fix that," she said. He studied her. "Administration already said no." "I know." "You're going to push on this anyway?" "Yes." He looked at her for another moment, running whatever internal calibration he ran. Then he said quietly, "Watch your back. That Stovall woman, she's been looking for a reason to clear me out of here, and she doesn't like people who make her look bad." "Neither do I," Nora said. "Tartum." She went to administration at 11 a.m. Dr. Margot Stovall's office was on the second floor, clean and aggressively organized, the kind of space that communicated authority through the absence of anything personal. Stovall was in her mid-50s, tall, with the careful grooming and controlled effect of someone who'd spent decades in administrative healthcare management. She had the particular skill of people in her position, the ability to appear receptive while actually dismissing everything being said. "Nurse Calloway," she said, after her assistant had shown Nora in, "I understand you've had your first sessions with Mr. Hale." "I wanted to discuss the animal situation," Nora said. She'd decided not to ease into it. "Rex, his service dog, was relocated 11 days ago. Mr. Hale's behavioral incidents began within 24 hours of that decision. The correlation is direct and documented in the incident reports." Stovall folded her hands on the desk. "Animal presence in the psychiatric ward is a facilities and safety determination. It's not within the scope of nursing care to—" "I'm not challenging the scope. I'm presenting clinical evidence that the relocation of a veteran service animal triggered a significant deterioration in his condition. I'd like to request that we explore a structured reunion and potential accommodation that meets both the patient's documented therapeutic needs and the facility's safety requirements." A pause. Something moved behind Stovall's eyes. Not consideration, but calculation. "I appreciate your advocacy," Stovall said. "That's exactly the kind of patient-centered thinking we value here. However, you should know that Mr. Hale's situation is being reviewed at a level above my office. There are considerations in his case that aren't visible at the floor level." She said it pleasantly, kindly, like she was doing Nora a favor. "I'd encourage you to focus on his day-to-day care and let the clinical and administrative teams handle the larger picture decisions. You're new here. There's a lot of context you don't have yet." Nora looked at her. "What considerations?" "I'm not at liberty to discuss that with floor nursing staff." "He's my patient." "He is," Stovall agreed, "and your role in his care is clearly defined. I'll have my office follow up with the nursing team on the animal question." She stood, which was a dismissal. "Thank you for coming in, Nora. It shows initiative." Nora stood. "Thank you for your time." She left. She didn't let anything show until she was back in the stairwell with the door closed behind her, and then she took one careful breath and let herself feel the specific quality of anger that came from being managed by someone who thought she was easy to manage. Larger picture decisions. Considerations above my office. You don't have the context. She had heard that particular language before. She knew what it meant. It meant, we have already decided something, and you are not part of that decision, and the kindest thing for you would be to not find out what it is. She went back upstairs and did her afternoon rounds, and she began quietly to pay attention. Prasa. By the end of her second week on the fourth floor, she had a clearer picture. It came together the way things always came together. Not in one dramatic revelation, but in the accumulation of small details that most people filed under administrative noise and moved on from. A facilities memo referencing a scheduled review of Ward 4's service animal policy. A conversation between two orderlies in the break room that stopped when she walked in. Beverly Pruitt's increasingly careful neutrality whenever Nora raised anything about Marcus Hale specifically. And the thing that had happened 3 days ago, which she was still turning over. She'd been charting at the nurse's station at 7:30 in the evening when she'd seen Dennis Chow, the ward administrator, walk past with a man she didn't recognize. Not a doctor, not a facilities person, something in his carriage and his eye contact that registered as official in a way she couldn't immediately categorize. They'd gone into the conference room at the end of the hall and closed the door. 40 minutes later, they'd come out. The man she didn't recognize had a folder under his arm. She'd caught one word through the conference room door as they passed, not from carelessness, just from the acoustics of the hallway. One word, clearly spoken by the man with the folder, discharge. She'd gone back to her charting. She'd been very careful not to look up. That night she pulled Marcus's chart again and went through it with the same attention she'd given it the first night, but looking for different things this time. Not the history, the recent additions, the notes from the last 2 weeks, the attending physician's entries, which had been growing progressively shorter and more clinical. A new notation, added 4 days ago, from Dr. Stovall's office. Patient continues to present challenges to standard therapeutic protocols. Case under administrative review, pending disposition determination. What disposition determination? That was a phrase that, in practice, meant one of three things: transfer to a different facility, discharge to outpatient care, or, in cases where neither of those applied, involuntary long-term psychiatric commitment. Marcus Hale was not a danger to anyone who wasn't actively threatening him or the people he was responsible for. She knew that with the same certainty, she'd known certain things in the field, not because of a checklist, but because she'd been reading people in high-pressure situations for long enough that she trusted her own read. He was a man who'd been deliberately destabilized and was being evaluated for his response to that destabilization. It was like kicking a dog and then writing a report about the dog's aggression. She sat with that for a long time. The morning, everything broke open, started normally. Nora arrived at 6:30 for the early shift, did her handoff, and went to check on Marcus first thing, as had become her routine. Rex had not been returned. Every request she'd made had been acknowledged and gone nowhere. But she'd been allowed 2 days ago to bring Marcus a recent photograph of Rex that she'd gotten from the ground floor kennel staff, and it was sitting on his windowsill now, facing the chair where he always sat. She found him already awake, which was not unusual. What was unusual was his stillness. He was sitting in the chair facing the door, hands on his knees, in a posture she hadn't seen from him before, something that was beyond his normal, careful control, something that read as anticipation. The bad kind. "They told you something," she said. He looked at her. "Chow came by last night, after your shift." "What did he say?" "Administrative review of your case is complete. The team recommends transition to long-term psychiatric residential facility pending capacity review." He said it like he was reading off a menu. Nora felt the specifics land. Long-term residential commitment, without family advocacy, without legal representation, with a documentation trail that had been carefully constructed over the past 11 days to support exactly that recommendation. She'd seen the construction of that trail. She'd been watching it happen. "What does that mean for Rex?" Marcus asked. His voice was level, trained level. She was quiet for a second longer than she should have been, and he heard it. "They're not going to transfer him with me." "I don't know that yet." "Yes, you do." No heat in it, just the flat knowledge of a man who'd been reading situations accurately for 30 years. "What are you going to do?" It was the right question, asked without pressure, without expectation, asked the way someone asked when they'd learned not to count on particular answers. "I don't know yet," she said, "but I'm not going to do nothing." He looked at her for a moment. "You need to be careful, Calloway. Stovall has been asking questions about you. Chow told me. I don't think he realized I'd care, or maybe he did. She's been asking about your previous employment, whether you were let go anywhere." The specific chill of that. Not fear, exactly. Something more functional. The recognition that the game had changed scope. When did Chow say that? "Last night, right before he told me about the residential facility recommendation." He looked out the window. "She's building a file on you." Nora stood there in the dim room with the photograph of Rex on the windowsill and a man who'd survived 3 combat deployments sitting in a chair, watching her with the careful eyes of someone who'd learned long ago how to tell who was actually on his side. "I'll be careful," she said. She meant it. She was also, already, several steps into thinking about what careful was going to need to look like. The meeting was called for 9 a.m. She found out about it at 8:47 when Beverly came to find her in the medication room with the careful, neutral expression that meant bad news wrapped in professional courtesy. "Dr. Stovall wants you in the conference room," Beverly said. "Now, if you can." "What's it about?" Beverly looked at her. One of those looks that was genuinely trying to communicate something without using words, because using words meant having said them. "Just come prepared," she said, and walked away. The conference room had 4 people in it. Dr. Stovall, Dennis Chow, and 2 others Nora didn't know. A woman who was introduced as Helen Farrow from HR, and a man identified only as Dr. Stovall's associate from the administrative team. Stovall had a file on the table in front of her. "Thank you for coming in," she said. She looked at Nora with the kind of controlled pleasantness that functioned as its own threat. "We want to talk about some concerns that have come to our attention regarding your conduct on the ward." Nora sat down. She laced her hands in her lap and kept her breathing even. "It's been brought to my attention," Stovall said, "that you've been conducting unauthorized conversations with Mr. Hale outside of documented care sessions. That you've made requests to administrative staff regarding patient accommodations without going through the proper chain of communication. And that you discussed Mr. Hale's case details with a facilities staff member in a way that may have violated protocols." Every single item was technically frameable the way she'd just framed it. Nora knew that. She also knew that the actual substance of every item was she'd advocated for her patient. "I've been providing patient care," Nora said, "which includes building therapeutic rapport and advocating for conditions that affect the patient's well-being. Within your defined scope," Stovall said, "which doesn't include administrative challenges to clinical decisions made above your pay grade." She smiled briefly. "I want to be very clear about why we're having this conversation. We value your presence here, Nora, but Mr. Hale is a complicated case, and the team that manages complicated cases here has significantly more experience and context than you do. What we need from you, what we need from floor nursing staff in situations like this, is trust in the institutional process." "What happens to Rex?" Nora said. A small silence. "Excuse me?" Stovall said. "When Mr. Hale is transferred to the residential facility, what's the plan for his service animal?" Stovall looked at her for a moment. Something moved under the surface of her controlled pleasantness, just briefly, just enough to confirm what Nora already suspected. "That's a facilities matter and not germane to this conversation. It's germane to my patient's care." "Nurse Calloway." Stovall's voice dropped half a register. "I'm going to be direct with you because I think direct is more useful here than diplomatic. You are in a probationary employment period. You have no institutional tenure. You have made administrative staff uncomfortable with your conduct, and you are now in a meeting specifically to address that. I would encourage you to hear what I'm saying." The room was very quiet. Helen Farrow from HR was writing something down. The administrative associate was watching Nora with the interested attention of someone who'd seen this particular scene before and was curious how the new variable would play. Nora looked at Stovall steadily. "I hear you," she said. "Good. Then I'd like your assurance that going forward, I won't give you that assurance." Stovall stopped. "I hear what you're saying," Nora continued, "and I understand exactly what this meeting is, but Mr. Hale is my patient. His deterioration over the past 11 days is directly attributable to decisions made by this administration. I'm not going to pretend I don't see that in order to make this conversation more comfortable." The silence in the room was a specific quality of silence. Stovall had been in it for about 4 seconds when Nora's pager went off. Not her pager. Every pager in the building. The overhead system, the corridor alert system, the rapid response cluster. The sound came from downstairs. Then it came from the hallway. Then it came from inside the conference room through the wall. Ward 4, room 412, Marcus Hale. Nora was already standing when the door opened. She was the first RN through the door of room 412, and she understood within 3 seconds what she was looking at. Not a psychiatric incident, not aggression. Marcus Hale was on the floor, and he was seizing. The posture was unmistakable to anyone who'd worked trauma. The rigidity, the jaw clench, the rhythmic muscular involvement along the right side of his body. The orderly who'd triggered the alert was standing against the wall with the specific frozen expression of someone who'd called for help and then run out of things to do. "How long?" Nora said, going to her knees beside Marcus. Maybe a minute? I don't know, I just came in for the vitals check. Get the crash cart, tell the desk, tonic-clonic, focal onset, right side dominant. I need a secondary RN, and I need neurology paged, not psych, neurology." She was already checking airway, positioning, the standardized movements that her hands remembered without her having to think. "Go." The orderly went. She worked. Not the way she'd been trained in nursing school, the way she'd been trained on a forward operating base at 2 a.m. with a patient who needed her hands to remember things faster than her brain could consciously direct them. She kept Marcus on his side, protected his airway, tracked the duration, called the assessment to the secondary nurse who arrived 60 seconds later. And when the seizure broke, 93 seconds she'd been counting, she stayed with him as he came back to consciousness in the confused, exhausted way of someone surfacing from a depth that had cost something. His eyes found her. "You're okay," she said. "You had a seizure. You're on the floor. I've got you." He blinked, tried to speak. Couldn't yet. "Don't try to talk, just breathe." She was aware, distantly, that Dr. Stovall had arrived in the doorway, that Dennis Chow was behind her, that the conference room meeting had effectively dissolved into this. She was aware of it the way she was aware of peripheral things when her central focus was engaged. Noted, filed, not yet relevant. What was relevant was that Marcus Hale had just had a first observed seizure with right-sided focal involvement, and nobody on his chart had noted any seizure history, and his medication panel hadn't changed, and the timing, 11 days of sleep deprivation, extreme psychological stress, a care environment that had been actively hostile to his well-being, was not coincidental. This wasn't a psychiatric episode. This was a medical crisis that had been incubated by administrative failure. She documented everything: time of onset, duration, laterality, postictal presentation. She called neurology herself when the overhead page hadn't produced a response within 4 minutes. She stayed in the room through the neurologist's initial assessment, spoke to the attending when he arrived, and gave a report so precise and detailed that the attending stopped once and looked at her with the particular attention of someone recalibrating an expectation. And when, 40 minutes later, Marcus was stable and transferred to a monitored bed, and the neurologist was writing orders, Nora stepped into the hallway and found Dr. Stovall still there, waiting. "We should finish our conversation," Stovall said. Nora looked at her. "Yes," she said, "we should." What she did not say, what she was holding in the specific, controlled place where she kept things she wasn't ready to use yet, was what she'd noticed when she was on her knees on that floor, working on Marcus Hale and calling assessments to the secondary nurse. She'd noticed that Marcus's medication chart had been updated 3 days ago. A new notation made by the night physician. A subtle dosage adjustment to one of his standing medications, not in a category that would typically cause concern, not the kind of change that triggered automatic alerts. Except she knew the interaction profile of that medication class. She'd had reason to learn it years ago in a context that had nothing to do with this hospital. And she knew that at the adjusted dosage, in combination with the sleep deprivation and stress that Marcus had been experiencing for 11 days, the risk profile for neurological events went from theoretical to measurable. She didn't know if it was deliberate. She didn't know if it was careless. She didn't know yet which of those two possibilities was worse. But she was going to find out. And standing in that hallway, looking at Dr. Margot Stovall with the careful pleasantness of a woman who thought she was still managing the situation, Nora Calloway made a decision. She was done being careful in the way they wanted her to be careful. She'd been doing this long enough to know that the moment you decided to stop managing someone else's comfort, the clock started. You had maybe 48 hours before the institution recognized the shift and responded to it, sometimes less. Stovall was still waiting in the hallway, arms crossed in the particular way of someone who'd arranged their body to project patients they weren't actually feeling. Behind her, Dennis Chow had his phone out, which meant he was either documenting or communicating. Either way, not good. "This isn't the time," Nora said. "My patient just had a neurological event." "Your patient is now in the care of the neurology team," Stovall said, "which means this is exactly the time." Nora looked at her steadily. "He had a focal seizure with right-sided presentation. I want to review his medication chart from the last 72 hours before we talk about anything else." "That's a physician decision." "I'm flagging a concern." "That's a nursing responsibility." Something shifted in Stovall's expression. Just slightly, just enough. "I'll have Dr. Yuen review the chart," she said. Dr. Yuen was the ward's covering psychiatrist, not a neurologist, and Stovall knew that as well as Nora did. "In the meantime, I'd like you to finish your shift in the general assignment pool. Beverly will handle your remaining fourth-floor patients today." It was a removal. soft-edged, administratively defensible, but a removal. You're taking me off Ward 4. I'm adjusting today's assignment given the circumstances. It's a standard operational decision. Stovall's voice was very level. I'd appreciate your cooperation. Nora took a slow breath. She thought about Marcus on the floor, his right side locked and rigid, and the medication notation she'd seen 3 days ago, and the man with the folder who'd walked out of the conference room saying discharge. She thought about all the ways this could go if she pushed right now, in this hallway, with Chow's phone recording and Stovall's expression already prepared for the conversation she planned to have about Nora's conduct afterward. Fine, she said. She spent the rest of her shift on the second floor doing routine post-surgical checks that required about 30% of her actual capacity and used the remaining 70% to think. The medication in question was an anticonvulsant that Marcus had been prescribed in a low-maintenance dose at admission, a common enough addition to the psychiatric polypharmacy of someone with his history of head trauma. 3 days ago, the dose had been quietly doubled. Not dramatically, not in a way that would set off automatic system alerts, but doubled. In a patient with his sleep history and stress load, that dosage change altered the neurological risk profile in a way that was documented in the clinical literature, if you knew where to look. Nora knew where to look because she'd spent 2 hours the previous week reading every journal entry she could access about TBI-related seizure risk in veteran populations, not because she'd suspected anything specific, but because she'd been trying to understand Marcus's complete picture. She didn't know if the change was intentional. She was not willing to assume it was. And she was not willing to assume it wasn't. What she knew was that it needed to be in front of someone with both the authority and the motivation to take it seriously, and neither of those things existed inside Harlow Medical Center's administrative structure. She called her sister that evening from the parking lot of her apartment complex, sitting in her car with the engine off. "You sound like you're about to do something that's going to get you fired," her sister said. "Maybe." "Tell me." She did, edited for the things she couldn't share and complete on the things she could. Her sister, who worked in HR for a construction company and had a highly practical intelligence, listened without interrupting, which was not her natural mode. When Nora finished, there was a pause. "You documented everything. Everything I can access. The medication change, the timeline, the incident reports, the meeting this morning. Can they lock you out of the records?" Nora had thought about this. "They can limit my access. I've already pulled what I need." Nora. Her sister said her name the way she said it when she was worried, which sounded almost the same as the way she said it when she was proud of her. "What do you actually want to happen here?" "I want Marcus Hale to get appropriate care and keep his dog. And I want someone to look at that medication change with more authority than I have. And if those two things cost you this job..." She was quiet for a moment. The parking lot was poorly lit, the kind of orange-tinged darkness that made everything look slightly provisional. "Then they cost me this job," her sister exhaled. "Okay. What do you need from me?" "Nothing yet. I'll call you when I do." She went back to the 4th floor the next morning. Beverly was at the nurse's station, and when she saw Nora, she did a small, careful thing with her face that was not quite surprise and not quite dread. "Your assignment this morning is..." "I know," Nora said. "2nd floor. I got the email." She kept moving toward the patient rooms. "I just need to check on something first." "Nora." Beverly's voice was low and urgent and genuinely alarmed in a way that was different from her usual professional register. It stopped Nora. "Listen to me for a second." She turned around. Beverly looked tired in a way that wasn't about sleep, the specific exhaustion of someone who'd been carrying something uncomfortable for a while. "What's happening with that patient," Beverly said, speaking quietly, eyes tracking the hallway, "is above your pay grade and mine. I know you think you understand the situation, but there are things in play that you're not seeing. If you keep pushing on this, if you go back into that room, they will use it. Do you understand what I'm saying?" "What things?" Nora said. "What am I not seeing?" Beverly shook her head. "Beverly." "I like you," Beverly said. "I mean that. I think you're good at this. But there are times when the only thing you can do for a patient is protect yourself long enough to be useful later, and I think this is one of those times." She paused. "Please go to your assigned floor." It was the most personal thing Beverly had said to her in 3 weeks. It was also, Nora suspected, the most frightened. She went to her assigned floor. She did her morning assessments, she checked her documentation, and she spent the quiet stretch between 9 and 11 thinking about what things in play could mean in the context of a ward administrator and a director of patient services, quietly arranging the commitment of a decorated special operations veteran. At 11:15, she sent an email. She'd spent 2 evenings deciding who to send it to, and the decision had required her to think about it the way she'd once been trained to think about resource requests in the field, not who should receive it according to the chain of command, but who had both the capability and the independent motivation to act on it. She'd identified 3 possibilities: the state's Department of Health Inspection Division, the VA's Patient Advocacy Office, and a third option that she'd initially dismissed as too much and had come back to twice. She sent it to all 3. It was factual, specific, and attached to a documentation packet that she'd assembled over 2 nights. It named no conclusions. It stated observations, timelines, and a specific clinical concern. It noted that she was a registered nurse at the facility and that she was filing in her professional capacity. She sent it at 11:15. By 11:47, she had a response from the VA Patient Advocacy Office requesting a call. By 12:30, she had spoken for 22 minutes with an investigator named Stuart Okafor, who asked questions in a sequence that told her, without his saying so directly, that this was not the first complaint his office had received about Harlow Medical Center's 4th floor. He said, at the end of the call, "Don't discuss this with facility administration. Don't share what you've filed. Keep a personal log of everything that happens from this point forward." "I already have one," she said. A brief pause. "Good. We'll be in touch within 72 hours. She went back to her afternoon rounds. She didn't tell anyone about the call. She charted a normal afternoon, talked to her patients the way she always did, and tried not to think too hard about the 72-hour window, because 72 hours was a long time when the people she was concerned about were operating on a faster timeline. It moved faster than 72 hours. The following morning, Nora arrived to find a note in her physical mailbox. The old-fashioned cubbyholes near the break room that most staff used for little more than parking stubs, and the occasional interdepartmental memo. The note was handwritten on a plain index card. No name. 4 words. "They're moving him Thursday." She stood in the break room for a moment, holding the card. Thursday was 2 days away. She turned it over, nothing on the back, and looked at the handwriting for a long moment. It was a careful, deliberate print, the kind of handwriting you used when you wanted it to be legible but didn't want it to be recognizable. Someone on the ward, someone who'd watched the same thing she'd watched and drawn the same conclusions and decided that the most they could do was leave 4 words on an index card and let someone with less to lose carry it. She slipped the card into her pocket and went upstairs. Marcus was awake, sitting up in the monitored bed they'd moved him to after the seizure. He looked better physically, more color, the specific clarity that came from actual sleep, which the monitoring team had apparently managed to produce where the psych ward hadn't. But he looked at her when she came in with the expression of someone who'd already done the math. "Thursday," he said. "You know, Chow came by again last night. He was—" Marcus paused, edited something. He was more careful this time. Didn't say as much. "But I know what final administrative review means." "Where's Rex?" Nora asked, because she needed to know what the full picture was. "Still in the kennel, as far as I know." He looked at his hands, then back at her. "They're not going to tell me what happens to him. I've asked 3 times. She sat in the chair beside the bed, not the professional distance of a nursing assessment, just sitting. "I filed a complaint with the VA Patient Advocacy Office. I've contacted 2 other oversight bodies. I want you to know what I've done so you can decide how you want to handle it." He looked at her for a long moment. "You know what happens to nurses who file complaints about hospitals they work in?" "Yes." "And you did it anyway?" "Yes." Something in his face shifted. Not gratitude exactly, because Marcus Hale didn't express things that cleanly. Something more complicated and more honest than gratitude. "I can't protect you from what's going to happen to you if this goes sideways," he said. "I know that." "And you're still here." "I'm still here." He was quiet for a moment, then, I need you to know something about why I came back here, to Wyoming, about what I was doing when they found me in that stairwell. He glanced at the door, then back at her. I wasn't having a breakdown. I was in a bad place, yeah. But the reason I was in that stairwell is that someone had been in my apartment, someone who knew what they were doing. Things were moved in ways that most people wouldn't notice. Nora held very still. I have files, Marcus said, from my last assignment, the undisclosed one. Things I was supposed to hand over to a specific contact when I got stateside, and then the contact went dark and I didn't know who to trust. I've been holding them for 14 months. He looked at her. I think whoever went through my apartment was looking for them. She heard the weight of what he was telling her. Not just the information itself, but the decision to tell her. He'd been sitting with this for 14 months, in a stairwell, in a psychiatric ward, in a monitored hospital bed, and he was telling her now. Where are they? She said. The files. Safe. Not here. His jaw tightened briefly. But if they transfer me to a locked residential facility and take my phone and my access, they can't transfer you to a residential facility without a legal process, she said. That's a 72-hour minimum statutory review in Wyoming. Unless they've already completed the review paperwork, unless the attending physician signed off. He paused. Have you checked the chart in the last 12 hours? She hadn't. She went to the terminal in the hallway and pulled it up, and what she found was that the attending physician, not the neurologist, the ward psychiatrist, had entered an updated evaluation note at 11 p.m. the previous night. The language was careful and professional, and recommended exactly what the administrative review had apparently already decided. The paperwork for Thursday was already complete. She had 24 hours, and she used every one of them. She spent the first 3 trying to reach Stuart Okafor at the VA advocacy office and getting his voicemail twice, and an assistant the 3rd time who told her the investigator was in a meeting and would return calls by end of business. End of business was 7 hours away. She left a detailed message and moved on. She pulled every piece of documentation she could legally access: medication records, the incident reports from the past 2 weeks, the original admission notes, and the specific redacted notations in Marcus's service record, and organized them into a packet that she copied to a personal drive she kept in her locker. She called the 3rd contact she'd emailed 2 days ago, the one she'd initially dismissed as too much. It rang 4 times and went to an automated routing system, and she navigated it carefully and ended up leaving a message in a queue she wasn't confident would be checked in time. At 3 p.m., she went back to see Marcus. He had a visitor. A man she'd never seen before. Civilian clothes, late 50s, a specific quality of unhurried attentiveness that she'd learned to recognize in people who spent their careers in environments where reading rooms accurately was a professional survival skill. He was sitting in the chair she usually sat in, and he stood up when she came in. Marcus looked at her. Nora, this is Warren Taft. He was my sergeant major in the first tour. Warren Taft put out his hand. His handshake was brief and firm. He looked at her with the same calibrating attention that Marcus used, the same zero social performance directness. You're the nurse, he said. I am. Marcus called me yesterday. He glanced at Marcus. I should tell you I was already aware of some of what's happening here. Not all of it. Some. How? Nora said. The VA complaint system routes certain categories of complaint to a secondary review office, Warren said. Particularly complaints involving active or retired personnel with specific service designations. I'm not going to explain what that means in detail because some of it I can't explain in detail. What I can tell you is that your filing yesterday moved faster than you might expect. Nora looked at him for a moment. How fast? There are people who are interested in this situation, Warren said, which was not quite an answer to her question and was clearly intended not to be. I came to see Marcus because he called me, and because what he told me lines up with something I've been watching for a while from a distance. He looked at Marcus. The files. Still safe, Marcus said. Warren nodded once. To Nora, what's their timeline? Thursday. The paperwork for residential transfer is already signed. Warren's expression did something small and controlled. That's faster than I thought they'd move. Faster than I thought, too. All right. He picked up his jacket from the chair. Here's what I need you to do. I need you to continue being a nurse. Do your job. Document everything. Don't vary your routine in any way that administration can point to. He looked at her steadily. Can you do that? What's going to happen Thursday? Something, Warren said. I need you to trust me on the details for right now. I don't know you, Nora said. No, he agreed. You don't. You know Marcus. Ask him whether I'm worth trusting. She looked at Marcus. 31 years, Marcus said simply. Yeah. She looked back at Warren Taft. She'd made a calculation like this before, not in a hospital, in a different context, in a place where the cost of miscalculation was immediate and physical. The same instinct that had walked her down that hallway toward a slamming meal tray was running the same assessment now. All right, she said. Warren Taft nodded and walked out of the room without another word, and Nora stood in the quiet that followed and felt the specific sensation of a situation that had grown significantly larger than the room it was sitting in. Wednesday moved slowly and then very fast. She arrived in the morning to find a note in her employee file. She only found out about it because a sympathetic HR clerk named Patrice mentioned it in passing while they were both in the copy room, in the careful, deniable way of someone who'd decided that their conscience was going to cost them a small risk. The note documented Nora's pattern of conduct inconsistent with facility protocols and was stamped as a formal written warning. First warning, which meant the second could be termination. She thanked Patrice, finished copying what she needed, and went upstairs. At 10 a.m., Beverly found her in the hallway outside Marcus's room. Beverly looked like someone who hadn't slept in a meaningful way in several days. She said without preamble, "They're saying tomorrow is a soft transition. That's what Stovall told the team this morning. Soft transition." She put quotation marks around those two words with her voice. "They're sending a transport team and 2 administrative staff from the receiving facility to make it smooth." Does Marcus know? He'll be told this afternoon by Dr. Ewan. She paused. The dog isn't going with him. That was decided this morning. Rex is going to animal control at end of business tomorrow. Nora looked at her. I know, Beverly said. I thought you should know the whole thing. She told Marcus at noon because he deserved to hear it from her before he heard it from Dr. Ewan. She sat in the chair and told him straight. The way she'd learned was the only way that actually helped, which was without softening and without the therapeutic distance language that made hard information feel managed, rather than true. He listened. His face did what faces do when something you expected hurts more than the expectation did, the brief involuntary contraction of something he was working to control. He was quiet for a long moment. Rex, he said. I know. Animal control. He said it like he was checking whether it was real. After everything that dog has, I know, Marcus. His hands were very still on his knees. When he looked up, his eyes were clear and dry, and carrying something that was going to need a long time to find its way out. You did everything you could, he said. It's not over yet, she said. I need you to trust me until tomorrow. He looked at her for a moment with that assessing directness. Do you know something I don't? I know that Warren Taft told me something was going to happen tomorrow. I know that the filing I made moved faster than I expected. And I know that what I don't know right now, I'm choosing to treat as information I don't have yet, rather than absence of information. He was quiet. Then, that's a very careful way to say you're hoping. Yes, she said. It is. That evening at 6:48 p.m., her phone rang. An unknown number, area code she didn't recognize. She picked it up. Ms. Calloway, a woman's voice, professional, unhurried. My name is Agent Dana Reyes. I'm with the Inspector General's Office, Department of Defense. I've been briefed on your filing and on some related matters regarding a patient at your facility. I have a few questions for you, and then I'm going to need you to do something that might be difficult. Nora stood in her apartment, coat still on from the parking lot, completely still. I need you to go to work tomorrow as if nothing has changed, Agent Reyes said. Can you do that? What's going to happen? Nora said. We've been investigating this facility and certain related matters for longer than you know, Reyes said. Your filing and some information provided through a separate channel has moved our timeline forward. What I can tell you is that you should be at work. You should be on the 4th floor. And whatever happens, your job is to keep being a nurse." "Rex," Nora said, "the service dog. If they take him to animal control, that's being handled," Reyes said. "I need you to trust me on the specifics." There was something in her voice, not warmth exactly, but the specific quality of someone who was being straightforwardly honest with her without embellishment. Nora had learned to hear that quality. "Okay," she said. "Get some sleep," Agent Reyes said. "Tomorrow's going to be a long day." The call ended. Nora stood in her apartment in her coat for another full minute, listening to the specific quality of the silence. Then her phone buzzed. A text from an unknown number, different from the one that had just called. No name, just a screenshot of a document header she recognized, the Department of Defense letterhead, a case reference number, and 3 words that stopped her cold. "Transport team confirmed." Below that, a second text. "They know you filed. Stovall is planning to terminate you tomorrow morning before the transfer. Arrive early." She stared at it, thought about what early meant and what it would look like and what it would cost her. Thought about Marcus Hale sitting in a monitored bed knowing that his dog was going to animal control. Thought about the index card with 4 words on it, left by someone who'd decided the most they could do was 4 words. She set her alarm for 4:30 a.m. She did not sleep until well after midnight, and when she did, it was the thin and restless kind of sleep that left her more tired than rested, which was fine. She'd done hard things exhausted before. She knew how it went. What she didn't know, what she was not prepared for, what no amount of forward operating base experience had quite given her a framework for, was what she was going to find when she walked through the doors of Harlow Medical Center at 5:15 in the morning and saw, in the parking lot, 3 unmarked vehicles that had not been there the day before. And standing beside the nearest one, a man in a dark jacket who looked up when she pulled in, and who she recognized, not from this hospital, not from this state, not from anything connected to her life here. From Syria. His name was Colonel Damon Frick, and the last time Nora had seen him, he was standing in a forward operating base outside Manbij with blood on his sleeve that wasn't his, giving a debrief to a casualty review team with the flat efficiency of someone who'd done it too many times. She sat in her car for 3 seconds. Just 3. Then she got out. He recognized her at the same moment she recognized him, and what crossed his face was not surprise. He'd known she was here. He'd known before he arrived. "Calloway?" he said. "Colonel?" "It's just Frick now, retired 8 months ago." He looked at the hospital entrance, then back at her. "You filed the complaint?" "Yes." "Good." He said it the way he'd said things in the field, not as encouragement, as confirmation that a required step had been completed. "There are 6 federal investigators inside that building right now, 3 more arriving in the next 40 minutes. There's a team at the residential facility in Casper that was supposed to receive your patient today, executing a parallel operation." He paused. "You need to go upstairs and be a nurse. Specifically, you need to be in that ward when this breaks open, because there are going to be patients up there who need exactly that." "What's happening to Stovall?" "She's going to be arrested before 9 a.m. No drama in it, just fact. There are 17 months of federal investigation behind what happens today. Your filing gave us the clinical evidence that was the last piece of a chain of custody argument we've been building. You didn't start this. You finished it." Nora stood in the pale pre-dawn cold of that parking lot and let that land. 17 months. The complaint she'd filed 2 days ago hadn't triggered this. It had arrived at the precise moment it was needed and slotted into something already in motion. "Rex," she said. "The dog stays," Frick said. "That order's already been issued. Animal control was notified last night. The transport order is rescinded." She exhaled. Something she'd been holding for days loosened fractionally. "Go do your job," Frick said. "We'll do ours." But she went through the entrance at 5:22. The lobby felt wrong in the specific way of a space that had more occupants than were visible. The slightly altered energy of people positioned in corners and doorways who weren't staff. She recognized 2 of them and kept her eyes moving in a straight line, the way she'd learned in environments where looking too long at something marked you as someone who'd noticed something. Beverly was at the nurse's station. She looked up when Nora came through the stairwell door, and her expression did something complicated. Relief and fear occupying the same moment. She opened her mouth. "Don't," Nora said quietly. "Just do the handoff." Beverly did the handoff. Her voice was mechanical and slightly too careful, the voice of someone reading from a script they weren't sure they believed anymore. Two of the overnight patients needed morning vitals. One needed a dressing change. Marcus had been given a sleep aid at 2 a.m. and was likely still under. "Has the transport team arrived?" Nora asked. Beverly stopped, started again. "They arrived at 5:10. They're in the conference room waiting for Dr. Yuen." "Okay." She went to see Marcus first. He was awake. The sleep aid had worn off or hadn't worked properly, and he was sitting in his chair in the way he sat when he'd been thinking for a long time. He looked at her when she came in and read something in her face before she said anything. "It's happening," he said. Not a question. "Something is happening," she said. "I need you to stay in this room regardless of what you hear. Can you do that?" He looked at her for a long moment. His jaw was tight with the effort of sitting still when everything in his training was probably telling him to position himself toward the action. "Yeah," he said, "I can do that." She did the other two patients, vitals, dressing change, the normal physical currency of morning nursing rounds, and she was finishing the dressing change when she heard it. Not a single loud event, a series of sounds, doors, voices at a register that wasn't normal conversation, the specific rhythm of people moving with coordinated purpose through a space that wasn't expecting them. Then Beverly's voice from the nurse's station, sharp and unprepared. "You can't just... You need to check in at the desk. I need to see credentials." And a voice she didn't recognize, calm and carrying. "Federal agents. We need this floor cleared of non-essential staff. All patients remain in rooms. I need the charge nurse to stay at the station." Nora finished securing the dressing. She told her patient to keep his arms still, that someone would be back to check on him shortly. She walked to the doorway. The hallway had transformed. 3 people in federal jackets were moving with efficient purpose toward the administrative end of the floor. 2 more were stationed at the stairwell. Beverly was standing at the nurse's station with both hands flat on the counter and an expression that had passed through shock into something that looked, Nora thought, like relief. Dr. Yuen came out of the conference room, stopped, looked at the hallway with the expression of a man who'd just understood that the situation he'd been part of was substantially different from the situation he thought he'd been part of. Dennis Chow came out behind him. His face was white. And then Dr. Margot Stovall walked out of her office at the end of the hall with a tablet in her hand and a schedule on her mind, and she stopped, and she looked at the hallway, and for one fraction of a second her controlled pleasantness was simply gone, peeled back by the specific shock of an institutional world coming apart faster than any contingency plan could address. She saw Nora. The look lasted maybe 2 seconds. Something moved through it that Nora couldn't fully categorize. Recognition, calculation, and beneath both of those, something that might have been the beginning of understanding how badly she'd misjudged the person she was looking at. Then Agent Reyes was there, badge out, speaking in the clear professional register of someone serving a federal warrant. Stovall's tablet hit the floor. She didn't pick it up. It was not clean. Nothing like this was clean. Dr. Yuen, it became apparent within the first hour, was not part of the core of it. He'd been directed and pressured and had made choices he shouldn't have made, but he was not the architecture. He sat in the conference room with an attorney the federal team had allowed him to call, and looked like a man reconstructing a sequence of decisions in his own mind and not liking the picture they made. Dennis Chow asked for a lawyer immediately and said nothing further, which was, Nora reflected, probably the smartest decision he'd made in the entire situation. The transport team from the Casper facility, 2 men and a woman who'd arrived in a facility van and were now sitting in the lobby being questioned individually, had no idea what they'd driven into. They were contractors. They'd been handed paperwork and told where to go. Their confusion was genuine and ultimately beside the point. Stovall was escorted downstairs at 7:43 a.m. She walked straight, shoulders back, the posture of someone who was not going to give the hallway the satisfaction of seeing her break. Nora watched her go from the nurse's station. Beverly came to stand beside her. After a moment, in a voice that was not quite steady, "How long did you know?" "I didn't know." Nora said. I suspected. I filed what I had and hoped the people it needed to reach would reach it in time. Beverly was quiet. Then, that notation in his medication chart. Yes. I saw it, Beverly said. Last week, I told myself it was within normal parameters. She stopped. It was within normal parameters. It was also above the threshold for neurological risk in his specific presentation, Nora said. Not accusatory, just the fact of it. I know you saw it. I know you didn't know what to do with it. Beverly looked at her. I'm sorry. Nora nodded. She didn't know quite what to do with the apology, so she accepted it and moved on, because there was still a ward to run and patients who had woken up to federal agents in their hallway and needed someone to tell them clearly and calmly what was happening. At 9:15, she went back to Marcus's room. He heard the change in the hallway before she got there. She could tell by the way he was sitting when she came through the door, different from before, the specific stillness of someone listening. It's done, she said. He looked at her, said nothing. Stovall's in federal custody. The transfer is canceled. Rex isn't going anywhere. She pulled the chair to its usual position and sat. There's going to be a process from here. Investigators are going to want to talk to you. You have the right to have legal representation present. I know my rights, he said. I know you do. A silence that was different from the silences before. Not the compressed tension of a situation that hadn't resolved, but something that needed a moment to find its shape. Rex, Marcus said. Still in the kennel. I'll take you down myself when the floor clears. He looked at the window. His jaw worked once. He got it under control with the same practiced discipline he got everything under control with. But she saw it, and she let it be there without comment. Warren Taft appeared in the doorway. He looked at Marcus, then at Nora. He didn't say anything for a moment, then to Nora. There are 2 people downstairs who want to talk to you, when you have a minute. Who? He considered the question briefly. People who've been watching this situation for a while. They have some things they'd like you to understand about what you walked into. He paused. And what you're going to be asked about next. She looked at him. Next? The files, Warren said quietly from the doorway. The ones Marcus has been holding for 14 months. The investigation into this facility is one thread. The reason this facility was specifically useful to whoever made the decision Stovall was executing, that's a different thread. And the federal team downstairs just pulled something from the administrative records that changes the shape of the whole picture. He looked at Marcus. Marcus looked at him with the expression of a man who'd suspected something like this and had been hoping to be wrong about it. What did they find? Nora said. Warren Taft stepped fully into the room, checked the hallway once, and closed the door behind him. When he turned back, the careful neutrality of his expression was gone, replaced by something that was neither calm nor alarm but occupied the exact space between them. 3 other patients, he said, on this ward, over the past 2 years, all special forces, all with classified service designations, all transferred to the same residential facility in Casper. He stopped. None of them have been heard from since. The silence after Warren Taft said it was the kind that didn't invite immediate response. 3 other patients, Special Forces veterans with classified designations, transferred to a facility in Casper over a 2-year window. Gone. Nora ran the word through its possible meanings and came up on 3. Dead, disappeared deliberately, or isolated in a way that made them functionally unreachable. None of those options were acceptable, and all of them were plausible. And the one that was most plausible, given everything she'd seen in the past 3 weeks, sat in her chest like something cold and dense. Marcus hadn't moved. He was looking at Warren with the expression of someone who'd suspected the larger shape of this and was now having the shape confirmed, which was different from being surprised by it, and in some ways worse. Names, Marcus said. Rutherford, Quan, and a woman named Tally Briggs. Warren said them the way you said names you'd been carrying. You know any of them? Rutherford and I overlapped in the second tour. Marcus's voice was level, doing the work of staying level. He had a traumatic brain injury from a vehicle ambush in 2019. Wouldn't have been hard to build a psych case around him. He paused. Tally Briggs was Delta adjacent. I heard she separated in 2021. She was admitted to this ward 14 months ago, Warren said. Transferred to Casper 6 weeks after admission. There's no patient record at Casper. No record, Nora said, making sure she'd heard it correctly. Facility says they have no record of admitting her. The state health department's file shows a transfer confirmation signed by this hospital. The receiving facility has no corresponding intake documentation. Warren looked at her. Someone made her disappear on paper before she arrived. Nora stood up. She needed to be standing for what she was about to say. Then the federal investigators downstairs need to be looking at the Casper facility right now, not just this one. And someone needs to pull the transfer documentation for all 3 patients and trace every signature on every page. That's already happening, Warren said. The parallel team I mentioned, they've been at the Casper facility since 6 a.m. What they found there is why the people downstairs want to talk to you. Why me specifically? He looked at her for a moment. Because you're a combat-trained medical professional who is currently the only person in this building who has spoken to Marcus at length over the past 3 weeks. And because the investigators believe the clinical documentation you filed contains evidence that links the medication protocol used on Marcus to a pattern that appears in the records of at least one of the 3 missing patients. She thought about the medication change, the dosage adjustment, the specific interaction profile, the fact that she'd almost filed it as a concern and then decided to file it as evidence instead. The difference between those 2 framings had felt small at the time. It didn't feel small now. I'll go down, she said. She looked at Marcus. Stay here. He gave her the look he gave her when she said things he found mildly unnecessary. I'll be here, he said. The 2 people Warren had mentioned were waiting in a ground-floor consultation room that had been temporarily commandeered. Someone had moved the patient pamphlet rack against the wall and set up a laptop and a file scanner on the small table. Agent Dana Reyes was one of them, which Nora had expected. The other was a man she didn't know, introduced as Supervisory Special Agent Bart Lemaire from a DoD sub-office, whose full name Reyes delivered in a way that indicated it wasn't the name most people used for it. Lemaire was compact, methodical, and had the kind of face that gave nothing away without effort. The face of someone who'd spent a long career in rooms where giving things away had consequences. He looked at Nora the way Frick had looked at her in the parking lot. Not appraising, exactly. Locating. We'll make this efficient, he said. You filed a clinical concern regarding a dosage adjustment in your patient's medication chart. I need you to walk me through the specific documentation and your reasoning. She did. She was precise. She used the clinical terminology she'd learned across 2 deployments and 3 years of hospital nursing, and she did not editorialize. When she finished, Lemaire looked at Reyes briefly. The patient Tally Briggs, Reyes said. Her admission records, the ones that still exist, show an identical dosage adjustment made 17 days into her stay here. Same medication class. The adjustment was made by a different physician, but the notation language is nearly identical to the one in your patient's chart. Template, Nora said. Someone was using a template. That's our read, Lemaire said. Which means it wasn't improvised, it was procedural. He looked at her steadily. We need your deposition on the clinical specifics, today if possible. Today is possible, she said. I need to finish my shift. Lemaire almost smiled. Of course. She went back upstairs. She did her noon rounds. She checked Marcus's neurological follow-up notes in the system, reviewed the updated orders from the neurology attending who had, following the morning's events, written a considerably more thorough evaluation than the one that existed 2 days ago. She ate half a sandwich from the vending machine at the nurse's station and drank bad coffee and kept her hands and her face doing the work of ordinary nursing while the rest of her processed what she was sitting in the middle of. A conspiracy that used a psychiatric ward to neutralize veterans who were carrying classified information. It was not a new idea. She'd read enough history to know the concept wasn't new, but the banality of its implementation was something different, not a movie villain operation. A hospital administrator, a ward administrator, a pliant physician, some paperwork, and a facility in Casper that apparently functioned as a terminus. Low tech. Hard to see if you weren't looking at the right layer of the system. Marcus had been lucky, in a specific and terrible way. He'd been lucky because he'd had Rex, because taking the dog had accelerated his behavioral deterioration faster than the medication protocol could establish a paper trail, and because that acceleration had happened in a window where Nora Calloway had been standing in the hallway and paying attention. She thought about Tally Briggs, about whether luck had factored into her timeline at all. At 2 p.m., her manager called. Not Beverly. Her nursing manager, a man named Gil Farrow, who worked out of the administrative HR office on the first floor and who she had spoken to exactly twice since her hire, both times briefly and procedurally. He called her cell, which meant he'd looked up the number specifically. "I need you to come to my office," he said. "I'm in the middle of afternoon rounds. Beverly can cover for 20 minutes. She noted the certainty with which he said that and went. His office was a small, window-adjacent room that smelled like file storage and reheated lunch. Farrow was in his early 60s, a bureaucratic management type who had probably started as a floor nurse 30 years ago and climbed into a role that required very little clinical skill and a great deal of institutional maintenance. He looked uncomfortable in the specific way of someone who'd been handed a situation and wasn't sure which side of it they were on. "I'll be direct," he said, which in Nora's experience meant the opposite was about to happen. "Given this morning's events, we're conducting a review of all nursing staff activity on Ward 4 over the past several weeks. Standard protocol in situations involving federal investigation." "Okay," she said. "During that review, some concerns have been flagged about your conduct." He had a folder open in front of him. Specifically, unauthorized disclosure of patient information, accessing records outside your assigned patient scope, making external communications regarding ongoing patient cases. She looked at him. "Those communications were to federal oversight bodies. They were part of a complaint process that has resulted in the arrest of your Director of Patient Services this morning." Farrow looked briefly like a man who'd been hoping she wouldn't say that quite so directly. "I understand that. However, the facility's position is that the process by which Gil," she used his name because she needed him to be a person for a moment and not a policy document. "I need you to hear what you're doing right now. This facility's director has been arrested on federal charges. There is an active federal investigation in this building, and you are sitting here telling me that my conduct in filing that complaint is under review." He opened his mouth. "If you issue any formal action against me today," she said, "you will be doing it in the context of an active federal investigation into this institution. I'd encourage you to think very carefully about how that looks and what it means." He closed his mouth. Something moved in his face, the grinding of institutional reflex against the reality of what the morning had produced. He looked down at his folder, then closed it. "That's all," he said. "For now." She stood up. "I'll be on the 4th floor if anyone needs me." She walked back to the stairwell and climbed 3 floors and did not let her hands shake until she was through the door and in the hallway, where she pressed them flat against her thighs for a count of 5, and then kept walking. The afternoon brought 3 things in sequence. First, Agent Reyes came upstairs at 3:30 and asked to speak with Marcus. Nora was present. Marcus gave a recorded statement that was factual, precise, and left out nothing except the specific contents of the files he'd been holding. He'd been briefed by Warren that the files themselves would be handled through a separate classified channel, which was fine with Nora, who didn't particularly need to know what was in them. What Marcus described was enough. The pattern of pressure he'd experienced since admission, the specific conversations with Chow and Stovall, the medication change that he'd noticed himself without knowing its significance. Reyes asked, at the end, "Did you feel that your safety was at risk inside this facility?" Marcus was quiet for a moment. "I felt that the people responsible for my care had a different agenda than my care. Whether that crossed into deliberate risk, yeah, I think it did." Second, the neurologist, a young attending named Dr. Voss, who had been on this case for less than 48 hours and was clearly still calibrating to the institutional chaos around him, came to review Marcus's monitoring results. He found Nora in the hallway and said, in the careful language of a physician who was choosing his words in an active federal investigation, "The seizure presentation is consistent with a medication-induced lowering of seizure threshold in the context of pre-existing TBY sequelae. The dosage adjustment in the record would have contributed to that risk profile." He paused. I've documented that in my notes. Thank you, Nora said. He nodded. Then, you caught it. I almost didn't. But you did. He looked at her for a moment, then went back to his charting. Third, at 4:45 p.m., Warren Taft came back upstairs and found her at the nurse's station. He looked like a man who'd received information in the last hour that had reorganized his understanding of the situation. They found Rutherford, he said. She turned to look at him. Alive? Alive. In a private behavioral health facility outside of Laramie that is not registered with the state board, operating under a corporate LLC that traces back through 3 shell layers to a private equity firm that has been investing in behavioral health infrastructure in Wyoming and 3 surrounding states for the past 5 years. He stopped. The firm has a board member with Department of Defense contracting relationships going back 12 years. Nora looked at him. They were building infrastructure to contain them. That's what it looks like. Warren's voice was controlled in the way of someone keeping something very large at arm's length. Not improvised. Not one bad actor. A system. Quan and Briggs? Still looking. Rutherford is in poor condition, but conscious. He's being transported to a federal medical facility. A pause. He asked for a lawyer within 30 seconds of contact, which means he's mentally intact enough to know he needed one. She absorbed that. The specific relief of alive mixed with everything that alive in that condition implied about what the past year had been for him. Marcus needs to know Rutherford's been found, she said. I know, I'll tell him. Warren looked at her with an expression that was doing several things at once, tired, determined, and containing something she read as a specific kind of professional regard. You did well, Calloway. I want to say that plainly. Briggs and Quan aren't found yet. No, he said. They're not. The deposition took 2 hours. She sat across from Lemaire and a federal attorney in the consultation room with a recorder running and gave everything she had. The medication chart, the incident reports, the meeting with Stovall, the note in her employee file, the phone calls, the index card with 4 words on it. She was precise and chronological and did not characterize anything she didn't have documentary support for. Lemaire asked follow-up questions that were sharp and specific, the questions of someone who already knew a great deal and was using her account to fill particular gaps. At the end, the federal attorney looked at her notes and said, Your clinical documentation of the medication concern is the only contemporaneous professional record that connects the protocol used on your patient to a pattern that appears in at least one other case. That makes it significant in ways that go beyond this facility. I know, Nora said. You knew when you filed it? She thought about it honestly. I suspected. I filed it because the alternative was to do nothing, and I don't know how to do that. The attorney looked at her for a moment with the expression of someone filing an impression. She wrote something in her notebook, capped her pen, and moved on. At 6:30, Beverly found her doing final chart updates before the end of shift. Beverly looked fundamentally different from the woman who'd stood at the nurse's station that morning. Not because anything external had changed, but because the specific tension of someone carrying a secret had discharged, and what was left was just exhaustion and something that might eventually become relief. There's a federal investigator talking to the overnight staff, Beverly said. Going through everyone. That's appropriate. I know. She was quiet for a moment, then, I want to tell you something. About the index card. Nora turned to look at her. I put it in your box, Beverly said. I wrote it in block print so you wouldn't know. She stopped. Reset. I've known something was wrong with how Hale's case was being handled for longer than I admitted to myself. I told myself I didn't have enough information to act on it. That was a partial truth. The other part was that I was scared. I know, Nora said. I should have done more. You did what you could do, Nora said. And it mattered. Beverly looked at her with the expression of someone who wasn't sure they deserved that, and Nora didn't push further because it wasn't her job to resolve Beverly's relationship with her own choices. That was work Beverly would have to do herself, and she'd do it or she wouldn't. Go home, Nora said. Tomorrow's going to be another long day. She was in the parking lot, keys in hand, when her phone rang. Reyes. We found Quan, the agent said. Same Laramie facility as Rutherford. He's ambulatory, disoriented but intact. A brief pause. Briggs is not there. Then where? We're working on it. The facility's administrator is currently providing information in exchange for cooperation consideration. He's been talking for about an hour. Another pause, longer. He mentioned a third location, a private residence registered to a medical LLC in Carbon County. We have people en route. Nora stood in the dark parking lot with her keys in her hand. Is she alive? We don't know yet. Reyes said it plainly, without softening. I'll call you when we know. She drove home. She made food she didn't taste. She sat on her couch with her phone on the cushion beside her and waited for it to ring. It rang at 11:17 p.m. Briggs is alive, Reyes said. She was in poor condition. She's in transport to a federal medical facility now. There was something in the agent's voice, not quite emotion, but the controlled version of it. She's been isolated for over a year. She had a service dog with her, actually, a golden retriever that someone apparently allowed her to keep. It may have been the only reason she maintained any psychological baseline. Nora thought about that for a moment. About a dog and a woman in a room in Carbon County, Wyoming, and the specific calculus of what keeps a person attached to the decision to remain alive. Thank you for telling me, she said. She didn't sleep until well after midnight for the second night running, but this time it wasn't anxiety keeping her awake. It was the quality of a mind that had been running at operational intensity for days and didn't know yet how to downshift. She lay in the dark and let it process. All of it. The ward, the medication chart, Stovall's face when she understood what was happening, Warren Taft closing the door and saying 3 other patients, Marcus on the floor in those 93 seconds, the index card with 4 words on it. She was asleep before she finished the list. The next 6 days moved in the specific rhythm of institutional aftermath. Not the dramatic pace of the event itself, but the dense procedural work of what came after. Federal investigators rotated through the facility. Lawyers appeared. Staff gave statements. The hospital's board called an emergency meeting, and by the end of it, 2 senior administrators had resigned. State health licensing began its own parallel review. Nora worked her shifts. She answered every question she was asked and volunteered documentation she wasn't asked for when she thought it was relevant. She watched Gil Farrow's formal written warning disappear from her employee file. Not with an explanation or an apology, just a quiet administrative removal, as if it had never existed, which was its own kind of statement. On the 4th day, she was called into a meeting with the hospital's interim director, a physician named Dr. Carl Weiss, who'd been brought in from outside on an emergency basis to manage the transition. He was 50-ish, wore reading glasses on a lanyard, and had the specific affect of a person who'd been handed a burning building and was determined to treat it as a project management challenge. He looked at her personnel file for a long moment before he spoke. You were given a formal written warning 5 days ago, he said. I was. That's been removed from your file. He took off his glasses. I want to be clear. That was done before I arrived. I can't undo a decision I didn't make, but I want to acknowledge it in this conversation. He looked at her. I've read your deposition. I've read the incident reports. I've spoken to Dr. Voss about the clinical documentation. He paused. I want to offer you a formal apology on behalf of this institution for the way your professional conduct was characterized. You identified a patient safety issue, you reported it through appropriate channels, and you were threatened with termination for it. Nora looked at him. I appreciate that. I also want to offer you a different role, he said. We're going to need to rebuild the 4th floor from the ground up. Staff, protocols, everything. I'd like you to be part of that, in a senior capacity. Patient safety lead working directly with the clinical team. It would require upgrading your contract and your compensation. He looked at her steadily. You can tell me no. Given what you've been through in this building, I would completely understand it. She sat with it for a moment, thought about Ward 4 and its 16 beds and the particular kind of patient who ended up there. People who'd been to places that left marks that didn't show on scans, who needed someone in their corner who understood what those marks meant and where they came from. I'll think about it, she said. That's all I'm asking. On the 6th day, she took Marcus downstairs herself. The kennel area was at the far end of the ground floor facilities wing, past laundry and equipment storage, access through a door that most of the clinical staff never had reason to go through. The kennel attendant, a young woman named Rosa, who had been quietly furious about the Rex situation for 11 days and had apparently told the federal investigators exactly that when they interviewed her, unlocked the kennel area without being asked and stepped back. Rex heard Marcus before he saw him. The sound the dog made was not a bark. It was something lower and more comprehensive, a full-body recognition that started in his chest and moved outward. He was at the kennel gate before Rosa had finished unlocking it, pressing his nose through the wire, and when the gate opened, he went directly and completely to Marcus with the unhesitating certainty of a dog who had never entertained the possibility that this reunion wouldn't happen. Marcus went to his knees. He didn't say anything. He put both hands on the dog and pressed his forehead down and stayed there, and Rex stayed with him, and Nora looked at the opposite wall and let them have it. After a while, Marcus looked up. His eyes were red at the edges. He didn't comment on that, and she didn't comment on it, and they went back upstairs together with Rex at Marcus's left side and the loose, watchful heel of a dog who'd been professionally trained but was currently operating in the Register of Relief. The legal machinery moved in its own time and on its own scale. What the federal investigation produced over the following weeks was a picture considerably larger than one hospital. The private equity firm connected to the Laramie facility had interests in 8 behavioral health operations across the Mountain West. At least 2 of those operations had received patients transferred from VA-adjacent hospitals under circumstances that were now under scrutiny. The board member with DoD contracting relationships, a man named Philip Gareth, who had spent 30 years cultivating the specific kind of low-visibility institutional power that operates entirely outside public awareness, retained a firm of federal defense attorneys within 48 hours of the investigation becoming public and said nothing further to any authority that didn't have a subpoena attached. Stovall, facing charges that included conspiracy, obstruction, and falsification of medical records, made a decision that her attorneys had almost certainly advised against. She asked to speak. Nora heard about it from Reyes, who called on a Thursday afternoon. "She's cooperating," Reyes said. "Partial. She's drawing a line at certain names and certain specifics, which tells us exactly where she thinks her personal jeopardy is highest. But she's confirming the operational structure." "Why?" Nora said. She seemed like someone who'd go down without talking. Her attorneys showed her the evidence chain. A pause. "The medication protocol documentation you identified was tied, through the deposition process, to a memo authored by the board member with DoD contracting interest. It has his fingerprints on it." When Stovall understood that the evidence pointed well above her, that she was positioned to take the full weight of something she'd been a mid-level operator in, she decided to be useful. "What happens to her?" "She'll do time," Reyes said. "How much depends on what she gives us. But she's not walking away from this." Nora thought about the hallway. Stovall's controlled pleasantness. "We value your presence here, Nora." The folder on the desk. The formal written warning that had lasted 4 days. "Okay," she said. "There's something else," Reyes said. "The deposition you gave, specifically the clinical documentation and your account of the medication concern, it's going to be central to the federal case, which means you're going to be asked to testify." "I know." "It also means your name is going to be attached to this publicly. At some point, if this goes to trial, you will be on record as the person who identified and reported the clinical pattern. I want to make sure you understand what that means in terms of your professional visibility going forward." Nora thought about visibility and what it cost and what it sometimes bought, about the shoebox under her bed and the commendation inside it, which she'd put away because visibility had felt like a liability and privacy like a form of protection. "I understand," she said. It was Marcus who told her about Philip Gareth. Not the full picture. She suspected there were layers of that she'd never have access to, and she'd made a kind of peace with that. But Marcus, in the expanded level of communication that had developed between them in the 2 weeks since the arrests, told her what he knew in the careful, factual way he told her most things. "Gareth has been running a quiet program for about 4 years, Marcus said, identifying separated SOF personnel who came out of specific operations with information he needed contained, not eliminating them. Too visible, too risky. Containing them, making them disappear into the system in a way that looked clinical and defensible. The hospital was an intake point, Nora said, one of at least 4. Harlow was useful because it was under-resourced, under-scrutinized, and Stovall had a financial relationship with one of Gareth's LLCs going back 7 years. He looked out the window. I didn't know about the other 3 patients when I came in here. I knew someone had been in my apartment. I knew I was being watched. I didn't know the mechanism. What's in the files? She said. The ones you've been holding. He looked at her steadily. Evidence of a procurement fraud operation connected to 3 classified contracts. Gareth's firm was a subcontractor on all 3. The contracts involved capabilities that he stopped. The specifics I can't tell you, but the reason he needed the information contained is that the evidence in those files would expose an arrangement between his firm and several government contracting officers that would end his business, his board positions, and his freedom. And you've been carrying that for 14 months. I had no idea who to trust with it. He said it with the flat honesty of someone stating a logistical problem. My contact went dark. I didn't know if that meant he'd been gotten to, or if he'd been ordered to stand down, or if he was just gone. I couldn't hand it to just anyone. Who has it now? People who were vetted through Warren and through Frick. It's been transmitted through a classified channel. It's out of my hands. He looked at her, which is the first time in 14 months I've been able to say that. She nodded. Sat with that for a moment. Nora, he said. It was the first time he'd used her first name unprompted. What happens when they don't need you here anymore? Are you staying? She looked at him. Dr. Weiss offered me a senior role. Are you taking it? I'm thinking about it. He was quiet for a moment. You should take it, he said. This ward needs someone who knows what they're doing, and you know what you're doing. It was, coming from Marcus Hale, approximately equivalent to a standing ovation from anyone else. On the 15th day after the arrests, Nora was doing afternoon rounds when her phone buzzed with a news alert. She almost didn't check it. She'd been limiting her news consumption deliberately because the coverage of the case had developed the particular quality of media saturation where the signal-to-noise ratio dropped with each passing day. She checked it. Philip Gareth had been arrested that morning at his residence in Scottsdale, Arizona. The charges included conspiracy to commit fraud against the United States government, obstruction of a federal investigation, unlawful detention, and a category of charge related to the misuse of behavioral health systems that the article noted was rarely invoked and carried a significant sentencing enhancement. His attorneys had issued a statement. He had issued no statement personally. She stood in the hallway of Ward 4 holding her phone, reading the article twice. She thought about Tally Briggs in a room in Carbon County with a golden retriever and 14 months of isolation. She thought about Rutherford asking for a lawyer within 30 seconds of contact. She thought about the index card with 4 words on it, left by a woman who'd been scared enough to print rather than write, and brave enough to leave it anyway. She put her phone in her pocket and finished her rounds. That evening, she was in the break room when Beverly came in for the end-of-shift handoff and said, without preamble, without making it a bigger moment than it was, "There's a call for you, line 2, some kind of DOD office." Nora picked up the landline. The voice on the other end belonged to a man who introduced himself as General Martin Achebe, Office of the Inspector General, Department of Defense. His voice was unhurried and precise. He said he was calling to inform her that a formal commendation process had been initiated in recognition of her role in the identification and reporting of a patient safety pattern that had contributed to the resolution of a federal investigation of significant scope. She listened. She said the appropriate things. She thanked him. She hung up. Beverly was looking at her from across the break room with an expression that was trying to be professionally neutral and not quite getting there. "What was that?" Beverly said. Nora set the phone down. She thought about the shoebox under her bed. She thought about being told, in a job interview years ago, that this kind of work was more emotionally nuanced than what she was used to, and the specific long patience of knowing something about yourself that no one around you could see yet. "Something I'll tell you about later," she said. "Go home, Beverly. I'll finish the clothes." She stayed at the nurse's station until the evening shift was settled, running through the end-of-day documentation with the practiced efficiency of someone who'd done it enough times that her hands knew the sequence. Ward 4 was quiet. 14 beds, most of them occupied. The particular nighttime quality of a psychiatric ward, not peaceful, exactly, but contained. Provisional in the way that a hard-won stability is always provisional. She was shutting down the last terminal when her phone buzzed again. Not a call this time. A text from an unknown number. Different from the ones before. A single line. Ms. Calloway. My name is Senator Patricia Howe. I chair the Senate Armed Services Committee Subcommittee on Veterans Healthcare. I've been briefed on your role in the Harlow investigation. I'd like to speak with you at your earliest convenience about what you found and what it means for veteran care nationally. She read it twice. Then she read it a third time, more slowly because she was beginning to understand that the room she'd been standing in for the past 3 weeks was considerably larger than the 4th floor of a hospital in Dunmore, Wyoming, and that whatever came next was going to require a different kind of careful than she'd been practicing. She set her phone down on the nurse's station counter. Outside the window, the Wyoming plains ran dark and flat toward mountains that were invisible now in the night. Somewhere on the floor below her, in a recovery room, Marcus Hale was sleeping with Rex beside him for the first time in 26 days. She picked her phone back up and began to type, then stopped, because there was something wrong with the text, something she'd processed and filed in the background while reading it, and was only now pulling forward into conscious attention. Senator Patricia Howe chaired the Subcommittee on Veterans Healthcare. She knew that name. She'd read about the subcommittee when she'd been researching the oversight structure during those 2 evenings before the filing. Senator Howe had announced her retirement from the committee 6 weeks ago. Her replacement had not yet been confirmed. The text said she currently chaired it. Nora stood at the nurse's station with her phone in her hand, the ward quiet around her, and felt the particular quality of a floor that had just shifted under her feet without making a sound. Someone knew she'd been briefed by the actual investigation team. Someone knew enough about the subcommittee structure to use a plausible name, but had gotten the timing wrong. Someone was reaching out to her right now, tonight, within hours of Philip Gareth's arrest, using a channel that was supposed to look official. She looked at the text again, at the phrasing, at the timing. Gareth had been arrested this morning. His firm had board members and contracted relationships, and 17 months of institutional reach, and most of that reach was still standing. The arrest of one man did not dissolve a network. Networks had redundancy. Networks had people who'd never been in a courtroom and whose names hadn't appeared in any filing yet. And someone in that network had just sent her a text. She forwarded the text to Reyes before she did anything else. No message attached, just the screenshot, because Reyes would understand immediately what she was looking at, and Nora didn't want to waste the 30 seconds it would take to explain it. Then she powered her phone to airplane mode, finished the close, and drove home by a route she hadn't used before, watching her mirrors the whole way, which was probably excessive, and which she did anyway. Reyes called her landline at 7:14 a.m. the next morning. The number traces to a prepaid, Reyes said, purchased in cash in Phoenix 3 days ago. We're working the cell tower data. A pause. You did the right thing forwarding it immediately. Senator Howe retired from the committee 6 weeks ago, Nora said. Yes, which tells us something useful. Whoever sent it has current intelligence about you, about the investigation, about the committee structure. But they're working from information that's a month and a half out of date on at least one detail. They're not operating from inside the current federal team. Gareth's network. Almost certainly, someone who understood enough to construct a plausible-sounding approach, but didn't have access to the most current committee rosters. Reyes's voice was level, doing what it always did, which was deliver information without decoration. We've been expecting some form of contact attempt as the arrest became public. This is probably the first and not the last. I need you to route everything. Any call, any text, any email from anyone you don't recognize, directly to me. Don't respond to any of it. Understood. And Nora. Reyes paused, which was unusual for her. We're nearly through this. I want you to know that. Nearly through was another 3 weeks of federal process, which anyone who'd ever dealt with federal process would recognize as optimistic. But it moved. That was the thing that surprised her. Not the speed, but the consistency of forward motion. Stovall's cooperation had opened architectural details that the investigation had been working to establish through documentation alone. And with those details confirmed, The case against the broader network developed a specificity that made the legal process considerably less ambiguous than it might have been. Philip Gareth retained a defense team of 7 attorneys. The defense team filed motions. The motions were addressed. There was a rhythm to it that Nora didn't try to follow in detail. Reyes kept her informed on the pieces that were directly relevant to her testimony, and she trusted the agent to know which pieces those were. The prepaid text was one of 3 contact attempts over the following 2 weeks. The second was an email, more sophisticated, using a genuine Senate staffer's name and email format with 1 letter transposed in the domain, the kind of thing that worked on people who weren't looking for it. The third was a phone call to the hospital's main line, asking for her by name from someone who identified themselves as a journalist and gave a name that, when she looked it up, belonged to a journalist who was currently on medical leave and would not have been making professional calls. She forwarded all 3 to Reyes. None of them rattled her in the way they were probably designed to rattle her. She'd been in environments where the attempts to destabilize you were faster and less politely constructed, and she'd learned in those environments that the function of that kind of pressure was to make you feel isolated, surveilled, and uncertain, and that the correct response to all 3 of those feelings was to keep doing the work in front of you. She kept doing the work.
Bon, madame.
She took the job Weiss offered. She made that decision on a Tuesday, standing in the ward with a patient's chart in her hand, watching the 4th floor operate in its new configuration. 2 new nurses hired specifically for their veteran care experience, updated protocols that had been developed with input from 3 separate veteran advocacy organizations. A service animal accommodation policy that had been written in consultation with a military working dog trainer and was now part of the facility's official operating manual. She thought about the woman in the job interview years ago who told her this kind of nursing was more emotionally nuanced than what she was used to. She thought about what it had felt like to hear that, and to know that the correct response was to say thank you and go find a way in through a different door. The ward needed someone who understood the specific terrain of it, not just the clinical competencies, which any good nurse could build, but the particular literacy of being in a room with a person who'd been somewhere that most of the world hadn't, and knowing how to be present in that room without performing understanding you didn't have or manufacturing distance you didn't need. She understood that terrain. She'd always understood it. She'd spent years being told that understanding was a liability, and she was done agreeing with people who were wrong about her. She told Weiss yes. The trial began on a gray Tuesday in October. Nora testified on the 3rd day in a federal courtroom in Cheyenne that was smaller than she'd expected and considerably more crowded. The gallery was full: journalists, veterans advocates, several uniformed military personnel she didn't recognize, and in the 2nd row, sitting straight-backed in a civilian suit with Rex at his feet under the bench, Marcus Hale. He'd insisted on being there. His attorney had cleared it with the court. Rex had been granted a formal service animal accommodation in the courtroom, which had required 2 separate motions and a brief hearing before the presiding judge, a woman named Judge Irene Callahan, who had handled the entire process with the efficient impartiality of someone who had no patience for theater from either side. Nora took the stand. She was sworn in. The federal prosecutor, a composed and methodical man named Avery Donaldson, walked her through her account in the same chronological sequence she'd given in her deposition, building toward the clinical documentation with the patience of someone who understood that juries needed the foundation before they could carry the weight of the evidence. She answered every question directly. She didn't perform emotion, and she didn't suppress it either. There were moments when the sequence of events, laid out in the flat language of courtroom testimony, produced in her a specific feeling that showed on her face, and she let it show because it was real and because juries understood real. The defense cross-examination lasted 40 minutes. The defense attorney, a polished, expensive-looking man named Winslow Carr, tried 4 different angles. He tried to establish that her clinical concern about the medication was speculative. She cited the literature. He tried to suggest that her employment history indicated a pattern of institutional conflict. She agreed that she had left 2 previous positions and explained the circumstances of each in a sentence each. He tried to imply that her filing was motivated by professional grievance rather than patient safety concern. She said, "My patient had a seizure. Identifying the contributing factor and reporting it wasn't a choice I made for professional reasons. It's what nurses do. Carr moved on. When she stepped down, she walked past the defense table without looking at it and past Stovall, who sat in the defendant's section with the controlled, diminished posture of someone who'd spent months being systematically confronted with the full dimension of what she'd participated in. Stovall didn't look at her. She sat in the gallery, 2 rows behind Marcus. He didn't turn around. She didn't need him to. The verdicts came on a Thursday, after 4 days of jury deliberation. Stovall, guilty on all counts. The sentence, delivered 3 weeks later, was 11 years. She would serve a minimum of 8 before eligibility review, and the federal sentencing guidelines for the specific conspiracy charges carried provisions that made early release considerably less likely than her defense team had probably represented to her. Dennis Chow had pleaded guilty before trial in exchange for cooperation testimony and received a reduced sentence of 4 years. Dr. Yuen, whose involvement the evidence characterized as coerced compliance rather than willing participation, received a suspended sentence and mandatory professional review, and surrendered his medical license for a period of 18 months pending reinstatement evaluation. Philip Gareth's trial was separate, federal, and considerably longer. The evidence chain that Marcus's files contributed to, transmitted through the classified channel, introduced through a process Nora was not entirely privy to and didn't need to be, formed the evidentiary core of charges that went well beyond what had happened at Harlow Medical Center. 3 former DoD contracting officers were named as co-conspirators. 2 of them cooperated. 1 didn't. Gareth was convicted on 7 counts. The sentencing was 22 years. He was 61 years old. His attorneys announced an appeal within 48 hours, which was expected and which the federal prosecutor's office had structured the case to withstand. Reyes told Nora the appeal would likely take 2 years to exhaust and would not change the outcome, and said it with the specific certainty of someone who'd built cases for a long time and knew when one was going to hold. Tally Briggs recovered. Not quickly, not cleanly. Recovery from 14 months of isolated institutional confinement doesn't work that way, and anyone who said otherwise would have been lying about what it took. But she recovered. She was transferred to a federal medical facility where the care was appropriate and the staff had been specifically vetted, and she was visited regularly by a legal advocate and by Warren Taft, who apparently took that responsibility on without being asked. Rutherford and Kwan were both discharged to outpatient care within 2 months. Nora received a brief, formal email from Rutherford's sister thanking her in a way that suggested she'd spent a long time on it and hadn't quite found the right words, which was fine because right words weren't really the point. She kept the email, filed it in a folder she'd never had a reason to make before. The Senate subcommittee hearing happened in November. The actual subcommittee, chaired by the actual senator who actually held the position, a woman named Senator Vivian Oates from Colorado, straightforward and technically knowledgeable in a way that made the hearing feel substantively different from the performative version Nora had expected, convened a 2-day session on veteran psychiatric care and the vulnerability of VA-adjacent facilities to administrative exploitation. Nora testified for 90 minutes on the first day. She talked about the specific clinical signs she'd identified and what had led her to look for them. She talked about the medication documentation and how it connected to a pattern she'd recognized from her own medical education and deployment experience. She talked about the systemic conditions, understaffing, administrative opacity, the cultural tendency to pathologize veteran behavior rather than contextualize it, that created the environment in which what had happened at Harlow Medical Center could happen and had happened and would happen again at other facilities if the structural vulnerabilities weren't addressed. She was not performing. She was not giving a speech. She was doing what she'd always done, which was taking something she understood and explaining it to the people who needed to understand it. Senator Oates asked, near the end, "What's the single most important change that would make veterans in psychiatric care safer?" Nora thought about it honestly. "Hire people who understand where those patients have been," she said. "Not just clinically, actually understand it. The gap between what veterans experience in the field and what most civilian psychiatric facilities are equipped to recognize is where the exploitation happens. Close that gap and the exploitation gets harder." Oates wrote something down. "And how do we close it?" "You stop treating military service as a credential that makes someone too aggressive for nuanced care," Nora said, and start treating it as a form of expertise, same way you'd treat any other clinical experience. The room was quiet for a moment. Fair point, Oates said. Marcus was discharged from Harlow Medical Center on a Friday in late November. He'd been moved out of the monitored unit and into a structured outpatient program 3 weeks before, which was the appropriate progression for where he actually was clinically, as opposed to where the previous administration had been trying to put him on paper. He'd been working with a therapist who specialized in SOF veteran care, a woman who came recommended by Warren Taft, and who Marcus described in his characteristically compressed way as useful, which Nora had learned to understand as high praise. On his last morning, she found him in the room he'd occupied for so long that the chair by the window had developed a particular worn quality, packing a bag that was considerably lighter than the institutional weight of 8 weeks should have produced. Rex was at his feet, watching the process with the alert, calm attention of a dog who was good at airports and transitions. "You've got a follow-up with Dr. Voss in 2 weeks," she said. "Don't skip it." "I know." "And the outpatient schedule." "Calloway." He said her name in the tone he used when she was covering logistics to avoid the other thing. "I know the schedule." She stopped. "Let the logistics go." He looked at her for a moment with the direct, measuring attention she'd gotten used to, the look that had nothing social in it and nothing performed. "You changed the outcome of this," he said. "I want you to know I understand that." "You would have found a way," she said. "Maybe, but it would have been slower and uglier, and I'm not sure Rutherford and Briggs would have come out the other side of it." He said it the way he said things that cost him something, flat, factual, not minimizing the cost, but not dramatizing it either. "What you did mattered. I'm not going to manage your feelings about that by being polite about it." She looked at him. "Okay." "Okay," he said. He picked up the bag. Rex stood immediately, triangulating to his left side, the professional ease of a dog who knew exactly where he was supposed to be. Marcus looked around the room once, the habitual sweep of someone who'd been trained to leave no trace, and walked to the door. He paused there, didn't look back. "Take the job," he said. "Don't let them talk you into something smaller." Then he walked down the hallway, Rex at his side, and through the stairwell door, and she stood in the doorway of the empty room for a moment in the particular silence of a space that had held something important and was now ready to hold something else. 2 months later, Nora was running the first training session for a new veteran psychiatric intake protocol she'd developed with Dr. Voss and 2 outside consultants, a former Army behavioral health specialist, and a military working dog trainer who'd spent 15 years in the same program that had produced Rex. The room had 12 nurses in it. Some of them were new hires. Some had been on the 4th floor for years and were relearning things they'd been doing wrong without knowing it. She stood at the front with a printed case study and no slides because she'd decided that the material was important enough to not hide behind a presentation. She talked about the difference between behavioral dysregulation and survival response. She talked about the specific clinical indicators of trauma-mediated aggression and how they presented differently from primary psychiatric pathology. She talked about how to be in a room with someone who'd operated in high-threat environments without performing calm you didn't have, or defaulting to distance when presence was what the patient actually needed. One of the new nurses, a young man named Torrance, who'd asked 3 good questions already, raised his hand. "What if you don't have a military background? Can you still connect with these patients?" "Yes," Nora said. "But you have to be honest about what you know and what you don't. Veterans don't need you to have been there. They need you to not pretend you understand things you don't, and to be genuinely curious about things you don't understand. That's it. That's the whole thing." Torrance wrote it down. She looked at the room, at 12 faces paying attention in the focused, imperfect way of people who were actually learning something, who weren't sure yet if they had it right, who would go home and think about it and come back tomorrow with better questions. Not a smooth room. Not a room that had figured everything out. Exactly the right room. She thought about a parking lot in pre-dawn dark, and 4 words on an index card, and 93 seconds on a floor counting a seizure duration, and a man asking permission to enter. "Sergeant?" And then realizing she'd framed it wrong, because that hadn't been the beginning. The beginning was quieter than that. The beginning was years of being told she was the wrong kind of person for the work she was built for, and deciding over and over in small rooms and large ones that the people who said that were working from information they hadn't bothered to verify. She'd never needed them to believe her. She just needed to stay in the room long enough for the truth to become unavoidable. "Okay," she said, "let's talk about service animals.